I think it's exciting, it's innovative, it's transformative. I speak a lot nationally and internationally, and it's an amazing model of care whereby specialists, primary care physicians and patients are much more included, much more involved. It's about breaking down silos, barriers, and basically developing a model of care to improve care. I'm involved with this COPD, so chronic obstructive lung disease initiative, which basically is involved in improving the care of patients with chronic obstructive lung disease, but also recognizing the fact that patients with a chronic disease like chronic obstructive lung disease also have heart failure, and there's not only silos between specialists and GPs, but there's silos between specialists who take care of heart failure patients and patients with lung disease. So we're developing models of care that actually improve the discussion and the interaction between specialists as well as physicians. So that to me is a very exciting opportunity. Scheduling patients, trying to develop electronic health records that will be interactive and supportive of specialists as well as primary care management. So we're basically involved in sort of facilitating and nurturing local activities, providing sort of support and advice to various community-based provincial-wide initiatives. We have been very fortunate getting funding from Vancouver Coastal Health to develop a very, well, maybe it's not very innovative, but it's what's turning out to be a very successful model of identifying patients when they're admitted to hospital with acute exacerbations of their underlying chronic obstructive lung disease. And then instead of them transitioning back into the community and navigating on their own, as it were, we actually have nurse practitioners and nurses going, identifying the patients in hospital and then following them into the community, talking to the GPs and visiting the patients at home. So we're breaking down that huge gap between the complexity of somebody who's had a very traumatic illness and then they go back into the community, which historically was a transition without a lot of support. So the numbers and our results are actually quite staggering. So it's sort of taking, and then creating that model here and having my colleagues in the other parts of the province coming to us and saying we'd like to replicate that model in their health authority. I've been at one or two of these events before, as it were, but I think what constantly strikes me as another very important component of these sort of interactions is that the patient is seen to be front on the stage and bringing their own story. And I think physicians have often got lost. They see themselves interacting with the patient in maybe a dominant, maybe the wrong term, but more hierarchical, as opposed to seeing the patient as a partner in their own care. And I'm quite interested in chronic disease management and education. You know, I think one of the exciting things for me in terms of engaging with patients has been the fact that we've actually had 2 Canadian Institute of Health Research projects funded where we've developed community-based models of education in Punjabi, Cantonese and Mandarin in both asthma and COPD. And we've engaged the patients and they've developed their own educational videos with their own perspective on the disease.